In order to provide a whole patient care, you need multidisciplinary working together, and social prescribers are an integral part of that team.
Social prescribing link workers often have an understanding of what's going on in a patient's life that may not be fully apparent to clinicians.
So we know that people are turning up to their GP with problems that the GP is not necessarily best placed to work with.
When it comes to people with long-term conditions, as a doctor, I can only do a tiny bit to help that person look after themselves.
We are able to explore things that GPs don't have the time to do.
Because if somebody comes to you and says that they're not sleeping very well, there's a reason. In 10 minutes, you can't get to the bottom of that reason why they're not sleeping. But in an hour, I can.
As GPs, we don't have the time and the resources to work out what is out there in the community, what services are available.
One of the advantages of having social prescribing in a GP practice is it can really allow the practice staff to see that not everything is medicalised, not everything needs some kind of treatment.
Many of the GPs actually say that without social prescribing, what they would seek to do is to avoid having holistic conversations with their patients and avoid giving patients the opportunity to open up about social issues that are going on in their lives, because they wouldn't then have an avenue for how to support the patient with those issues. But the wonderful thing that social prescribing does give them is it gives them the opportunity to not fear having an open conversation with patients about what's going on in their life, what some of the issues behind the issues might be.
This is a tool, this is an answer.
It's been really lovely in the last 9 months to see the uptake and the way in which every member of the staff team has interacted with the social prescribers.
It's really important for them to be part of the multidisciplinary team and to be really part and at the heart of the practice, and to everyone is as important as each other.
Yes, we work with the MDT teams. Some have mental health nurses in the team, some have nurse practitioners, some have got paramedics.
Social prescribers attend those meetings and they'll pitch in and they'll say, oh, we could just contact that patient and say X, Y, Z. And it's really helpful.
It's not just the GP, it's the receptionist that can also send us a referral, it's the nurse, it's anybody in that practice. They all feel empowered to do that too.
I've worked with GPs, I've worked with social workers, I've worked with therapists, I've worked with in a multidisciplinary approach.
Being able to build those relationships with all of the people in the surgery, I think, is absolutely crucial to making sure that social prescribers have got visibility on the work that they're doing, and understanding of the impact that they can achieve.
They need to be in the practice, part of the primary care team, there for the practice meetings, there for the integrated care management meetings.
My clinical director keeps saying, you guys have made such a difference, it's amazing, it's amazing.
It's like this is a symbiotic relationship. Everyone wants the patient's well-being.